Hello and welcome to The Explainer. Today, we're going to dive into a piece of medical tech that you've almost definitely seen, maybe in a hospital or on a TV show, the PCA pump. It's a really common way to handle pain after surgery, but how does it actually work? And maybe more importantly, how on earth does it keep you safe?
I want you to just imagine this for a second. You're recovering from something, you're starting to feel that pain creep in. But right there in your hand, you've got a simple button. A button that gives you the power to get relief at the exact moment you need it. That's the whole idea we're going to unpack today.
All right, so let's start at square one. What exactly is this button for your pain?
Well, the official name is Patient-Controlled Analgesia, or PCA for short. And you know, the name really says it all. It's a method that was specifically designed to shift the power of pain management directly into your hands, the patient's hands. The whole goal is to give you relief on your schedule, not when a nurse happens to have time to do their rounds. You know, when you actually break it down, the system is pretty simple. First, you've got this smart, computerized pump, and inside is a locked syringe of pain medication, usually something like morphine, prescribed just for you. Then, that pump has a line that connects right into your IV. That direct connection is what allows for really fast relief.
So how does this whole system actually work when you're the one using it? This next part is all about putting you, the patient, right in the driver's seat.
Honestly, the process couldn't be more simple. Step 1, you start to feel pain. Step 2, you press the button. Step 3, the pump instantly delivers a preset dose of medication. It's an immediate response to what your body is telling you. And that can actually help you stay ahead of the pain, which can in turn help you recover faster because you're just more comfortable.
Your doctor can also customize how you get the medicine. One way is with what's called a basal rate. That's a small, constant flow, like a little drip, to manage that background pain. You still have the button for any extra pain that flares up. The other way is purely on demand. The pump does nothing until you decide it's time to press that button.
Okay, now for the big one. The question that I'm sure is on everyone's mind when they hear about a button for pain medication. Let's talk about the built-in safety net. This is the #1 concern, right? And it's a totally fair question. If I'm the one in control, can I mess up and give myself too much? The short answer, and this is the good news, is no. The machine is specifically designed to stop that from happening. So the main safety feature is something called the lockout interval. Here's how it works. After you get a dose, the pump starts a timer that's been preset by your doctor. During that lockout period, you could literally press the button 100 times. It won't do a thing. The machine simply will not give you another dose until that time is up. This is the absolute core feature that prevents an overdose.
And that's not all. The pump is also programmed with a maximum limit for a certain amount of time, say 1 hour or 4 hours. The syringe with the actual medicine, it's locked inside the machine. Even the power buttons are locked away. The only person who can change the dose or the settings is a trained nurse or doctor who has a special key or a code. So yeah, you control the button, but they control all the safety settings around it.
This brings us to a really important point. Even though you're the one with the button, you are definitely not in this alone. Managing your pain with the PCA is a total team effort.
Think of this as a partnership. Your job is pretty simple. Press the button when you hurt. But here's a key one. Don't press it if you're feeling too sleepy. That's a sign your body's giving you. And this is critical. You have to be the only person who presses that button. No well-meaning family members, nobody else. Meanwhile, your care team is constantly monitoring everything. Your pain levels, your vital signs, and exactly how you're using the pump.
And let me tell you, your care team is incredibly thorough. They're checking your pain on that 1 to 10 scale. They're asking how sleepy you feel. They're checking your vital signs like your heart rate, your breathing, blood pressure, oxygen levels, all of it. They're also on the lookout for side effects like nausea and are even keeping an eye on the IV site. They can even see how many times you tried to get a dose during that lockout period. All of this information helps them make sure you're safe and comfortable.
Which brings us to a really vital point about communication. You have to tell your medical team about every single other medication you are taking. I'm serious. This is especially true for anything that makes you drowsy. Think sleeping pills, certain allergy meds, or anti-anxiety drugs. Mixing those with this kind of pain medication can be really dangerous.
Okay, so you've used the PCA, you've gotten through the worst of the pain. Now what? What happens next?
let's talk about the final phase of your journey with the PCA.
I absolutely love this quote from the source material because it's just so reassuring. Most patients self-wean. It's not some big, scary process you have to go through. It's actually really intuitive. As your body starts to heal and the pain naturally gets better, you'll just find yourself reaching for that button less and less often.
So the process is designed to be a really smooth handoff. You start healing, you naturally use the pump less. Then, once you and your doctor decide it's time, they stop the PCA, and you can switch right over to pain pills immediately. That means there's no gap, no period where you're left without any pain relief.
So, when you think about it, the PCA pump is just a fantastic example of putting safe, researched control right into the hands of patients. It makes you an active part of your own healing journey, which, leaves us with a pretty fascinating question to think about. As our technology gets even smarter and our understanding of medicine gets deeper, how much more control will we as patients have over our own recovery? Thanks for joining this explainer.